Hello, Namaste. I'm Dr. Krishna Chaitanya, Consultant Vascular and Endovascular Surgeon at Aster RV Hospitals, Bangalore. Today I'm going to talk to you about a problem called as Peripheral Arterial Disease. What is Peripheral Arterial Disease? Peripheral Arterial Disease is a condition which leads to blockage of blood flow in our blood vessels which supply blood to system which is apart from the heart. Now, heart is supplied by channels which carry blood called as coronary arteries, while rest of the body is supplied by nearly 60,000 miles of blood vessels which are called peripheral vasculature. These involves arteries which supply blood to most part of the body, including brain, our stomach, all the organs inside the stomach, our upper limbs, hands, and both the lower limbs. Conditions which lead to blockage of these blood vessels are called as peripheral arterial disease. Who can develop peripheral arterial disease? Peripheral arterial disease is a condition which affects many of the elderly population. One of the risk factors for development of peripheral arterial disease is elderly age group, that is beyond 60 years. Genetic factors play a very important role in development of peripheral arterial disease. Any person with a family history of either a heart disease or stroke, or any person whose parents or his family members have suffered from gangrene of limbs are at risk of developing peripheral arterial disease. How do I know if I have peripheral arterial disease? A very important symptom which is missed by many people in peripheral arterial disease is a condition called as claudication pain. Now, what is this claudication pain? A person affected with peripheral arterial disease cannot walk for too long a distance without stopping. A person, when he starts walking, is all right, but upon walking a certain distance of time, he develops pain which either affects his feet or in the calf muscles or in the thigh muscles or in the buttocks. He walks to a point where the pain does not allow him to walk anymore. At this point, he is forced to stop. Upon stopping, his pain comes down and he resumes walking again to almost a similar distance by which he develops the pain. Now, this is a very important sign which is frequently missed. In our country, we do not expect the elderly population to be very physically active. We do not expect them to walk for too long. We think they are old, and that is exactly the reason why we miss so many of the peripheral arterial disease. Peripheral arterial disease is supposed to be actively screened in every person who is above 60 years, who has a past history of smoking, who has a history of high cholesterol levels in his blood, who has a family history of heart disease or a personal history of heart disease, who's had a family history or a personal history of strokes, or if the person is obese. Also, kindly note that there is a special category of patients called peripheral vascular disease in diabetics. There is a strange problem attached in diabetes. Most of these patients do not have appropriate feeling of sensation in their feet. They cannot feel the pain in their foot. What can this lead to? Kindly understand that whatever the symptom we described for peripheral arterial disease as claudication pain is frequently missed in diabetics. Just like a silent heart attack in diabetics, there can be a silent claudication pain in patients suffering from long-standing diabetes. Kindly get all the patients with diabetes actively screened above 60 years to see if they have peripheral arterial disease. Should you worry if you have a peripheral arterial disease? There is no need to worry if you have peripheral arterial disease. Kindly consult your vascular surgeon who would suggest appropriate tests to detect the severity or the nature of your blood flow. Depending on that, your vascular surgeon is the most appropriately suited to either suggest what is the right treatment for you. It could be just medicines, it could be changes in your lifestyle, it could be changes in your risk factors, it could be suggesting certain exercises, or sometimes when the peripheral arterial disease is too severe that it causes some part of the toe or a wound to turn a little dark or gangrenous, what we would say, your vascular surgeon would suggest you an appropriate surgical intervention, which can be either a bypass surgery or a needle hole procedure, which is called as angioplasty and stenting. What is the nature of life after peripheral arterial disease? Many of the individuals who have undergone successful treatment do very well after peripheral arterial disease, although they have to be on long-term follow-up. What is the right treatment? I am confused whether I have to undergo an angioplasty stenting or do I have to undergo a bypass surgery. The right option is to get yourself checked by the right vascular surgeon. Here at Aster RV Hospital, we treat our patients, we diagnose them by angiographic evaluation. We would either suggest them to do a CT angiogram, an MRI angiogram, or just like a heart angiogram, we would do a peripheral angiogram. Depending on the peripheral angiogram, depending on the extent of the disease, we would suggest you what is the most appropriate treatment, which will be based also on your fitness for the procedure. We would either do a bypass or we would do a minimally invasive technique like a angioplasty. Now, if I have had a family member who's had a peripheral arterial disease, who has gone through a lot of surgical techniques, and you do not wish to get peripheral vascular disease, you want to ask what are the things you want to do to avoid peripheral vascular disease. How do you prevent peripheral vascular disease? Kindly maintain a physically active lifestyle, avoid smoking, avoid risk factors which develop peripheral vascular disease like keeping your diabetes under control, have a low carbohydrate and a low fat diet, maintain a healthy lifestyle and a stress-free lifestyle.